in terms of the many innovations that we're seeing emerging out of healthcare and radiology and imaging in particular. First and foremost really is around just the generative AI and how there's a lot of advancements being made in responsible AI. And I think that's really important. Right? Artificial intelligence is growing at such an exponential rate, and many innovators and companies, as well as health systems, are pushing the boundaries of responsible AI and making sure that there is the right governance and the right boundaries in responsible AI. So that's number one. The second really is around workforce. So if we've looked at the last year, there are many elements of how artificial intelligence is directly affecting workforce, both in how we're garnering massive amounts of efficiency for rad techs and radiologists and clinicians across the board, as well as where there are specific advancements that are being made in terms of training the future workforce that is AI ready. So what's really interesting in terms of the practical adoption of artificial intelligence and things like modalities and imaging software is really the workflow elements of how AI is making workflow actually happen, right? So I've always said that if it doesn't work and if it doesn't flow, then it's not workflow. What artificial intelligence has been doing is really accelerating the usefulness of these workflows and taking out all of those kinks and those roadblocks that have been sort of artificially existing in the adoption of a lot of these capabilities. So it's really interesting. We use the word or the term artificial intelligence, but I really think about it as augmented intelligence. If anything, we're trying to remove the artificial barriers that technology has instilled in the interactions between human beings and technology at the other end. Right? So if you think about the adoption of technology in the last 30 years or so, it really has been an artificial barrier that has been erected between the human being, the clinician, the patient, and technology at the other end. And what AI actually allows us to do is to humanize the experience. So it removes those artificial barriers that actually exist as a result of technology. And so it's a bit of an enigma in sorts, in the sense that AI is actually humanizing the workflows that are available to us.